Every single day, doctors are basically detectives. They're piecing together clues to solve these really complex medical mysteries. And today, you're going to join them. We've got two baffling cases to crack, and all the evidence you need is right here. So let's just dive right in. We have two patients, two totally different problems, and a trail of clues for each. Here's your challenge. See if you can spot the crucial patterns before we reveal the diagnosis. You ready to play detective? Let's go. Okay, let's open up our first case file. This one's about a young man whose main complaint, back pain. Sounds super common, right? But as you're about to see, the details are, well, they're anything but ordinary. So meet our first patient. He's 35 years old, and for the last 3 months, he's been dealing with this nagging back pain. Now, on the surface, that sounds like a million other cases you'd hear about. But the real story, the key to the whole puzzle, is hiding in the details. And this is where the mystery really starts to deepen. The pain didn't come from some obvious injury. It had what doctors call an insidious onset. It just kind of crept up on him, almost sneakily. And get this, strange pattern. It's actually worse when he rests, especially at night and in the morning, but it gets better with exercise. He also mentions this weird pain that seems to shift from one side of his butt to the other. That, right there, is our first major lead. Just think about that for a second. If you pull a muscle, what do? You rest it. But for this guy, resting makes the pain worse and moving makes it better. That completely counterintuitive pattern is the key to this whole mystery. It's pointing us in a very, very specific direction. Okay, with those clues in our back pocket, it's time to pull the mask off the culprit behind this patient's really unusual pain. And there it is. The diagnosis is ankylosing spondylitis, or AS for short. This is a type of inflammatory arthritis that mainly goes after the spine. It's actually the body's own immune system causing all that inflammation. And suddenly, all those bizarre clues start to make perfect sense. The big concept here is something called inflammatory back pain. It's the total opposite of mechanical back pain. The kind you get from an injury. With mechanical pain, you rest. But with inflammatory pain, moving around actually helps flush out all the inflammatory stuff that builds up in the joints overnight. That's exactly why that morning stiffness gets better as he gets his day going. That distinction isn't just a detail, it's everything. Any good detective always has to rule out the other suspects. So, mechanical back pain? Nope. His pain gets better with activity, not worse. So that's out. How about lumbar spinal stenosis? Well, that usually causes pain when you're walking, and that's not his main issue. Rheumatoid arthritis. That typically hits the smaller joints, like in your hands and feet, not mainly the spine and the sacroiliac joints. So when you eliminate all the impossible options, ankylosing spondylitis is the only diagnosis left that fits all the evidence. All right, one case solved. But our next one, it's a whole different level of urgency. We're shifting gears from a chronic, creeping problem to an acute, full-blown medical emergency. Our second patient is a 55-year-old woman, and right away we get a critical piece of background info. She has chronic hepatitis C. This is a really important risk factor that immediately puts us on high alert. The clues in this case are just dramatic. The onset was acute, meaning it happened suddenly out of nowhere. Her left knee is incredibly painful and swollen, but there was no fall, no injury, nothing to explain it. And here's the absolute clincher. When the doctors draw fluid out of the joint, it's cloudy. That is a massive red flag. Yeah, the source material does not mince words here. It states directly, this is a medical emergency. There is zero time to waste because whatever is happening inside that knee joint is aggressive, and it's actively destroying it by the minute. So what on earth could cause such a rapid and severe reaction in just one single joint? Well, the answer is hiding inside that cloudy fluid.
Here it is, the smoking gun. 50,000. That is the white blood cell count in a tiny drop of fluid from her knee. Now, to put that in perspective, a normal, healthy joint has a count under 200. A number this high just screams one thing: a massive infection. Her body is waging an all-out war inside that joint.
And that leads us straight to our diagnosis, septic arthritis. It's a dangerous infection inside the joint, and in her case, lab cultures confirmed the invading bacteria was Staphylococcus aureus.
So what is septic arthritis exactly? It's what happens when bacteria from somewhere else in the body travel through your bloodstream and decide to set up camp inside a joint. The body's immune response creates this huge, painful inflammation that can just rapidly destroy the joint's cartilage if it's not treated immediately.
Now, you might be thinking, other things can cause a swollen joint, right? So how do we know for sure it's an infection? Well, the key difference is the cause. In something like gout, the inflammation is caused by these sharp microscopic crystals. But in septic arthritis, the cause is a literal bacterial invasion. Let's go back to our detective work and rule out those other suspects. Gout or pseudogout? Nope, the lab found 0 crystals. What about osteoarthritis? Well, that's a non-inflammatory condition. Its white blood cell count would be way down, under 2,000, not over 50,000. And rheumatoid arthritis. Again, that's typically a chronic thing affecting multiple joints, not a sudden, brutal attack on just one. The evidence here is just overwhelming.
So, we've solved both cases. Now, let's just take a step back and look at the diagnostic tools and the thinking that got us to the right answers. What are the big takeaways from this whole process?
Really, it all comes down to the detective's method. First, you have to listen to the story. The patient's history almost always has the most important clues. Second, you identify the pattern. Is this pain inflammatory or mechanical? Is the problem acute or chronic? And third, you use the right test. In our second case, that single lab test on the joint fluid wasn't just helpful, it was definitive. It gave us the answer, plain and simple. And that kind of leaves us with a final thought to chew on. In any diagnostic puzzle, whether it's a chronic backache or an emergency swollen knee, there is so often one single piece of information, a tiny detail in the story, a number from a lab report, a specific pattern that changes absolutely everything. The real key is knowing how to find it. Thanks for joining me for this explainer.